Welcome to Med Madness. Today's topic, understanding cranial nerves. Can you name any of the cranial nerves and their functions? Let's find out. Let's dive into the overview of cranial nerves. There are 12 pairs of cranial nerves originating from the brain and brainstem. They have various sensory, motor, or both functions. Stay tuned as we explore each one in detail. The first cranial nerve is the olfactory nerve. It is responsible for the sense of smell, and its pathway runs from the nasal cavity to the olfactory bulb. What happens if the olfactory nerve is damaged? Comment your thoughts below. The second cranial nerve is the optic nerve, responsible for vision. It runs from the retina to the optic chiasm. Can you name a condition affecting the optic nerve? Let us know in the comments. The third cranial nerve is the oculomotor nerve, which controls most of the eye's movements and pupil constriction. It runs from the midbrain to the extraocular muscles. What is the effect of oculomotor nerve palsy? Comment below. The fourth cranial nerve is the trochlear nerve. It controls the superior oblique muscle, helping in the downward and lateral movement of the eye. How does trochlear nerve damage affect vision? Share your thoughts. The fifth cranial nerve is the trigeminal nerve. It is responsible for facial sensation and chewing. It has three divisions: ophthalmic V1, maxillary V2, and mandibular V3. What is trigeminal neuralgia? Let us know in the comments. The sixth cranial nerve is the abducens nerve. It controls the lateral rectus muscle, responsible for outward gaze. What does abducens nerve palsy look like? Comment below. The seventh cranial nerve is the facial nerve. It controls facial expression and taste sensations from the anterior two-thirds of the tongue. Can you identify symptoms of Bell's palsy? Share your thoughts below. The eighth cranial nerve is the vestibulocochlear nerve. It is responsible for hearing and balance. What symptoms arise from vestibulocochlear nerve damage? Comment below. The ninth cranial nerve is the glossopharyngeal nerve. It is involved in taste, swallowing, and the gag reflex. How does glossopharyngeal nerve damage affect swallowing? Let us know in the comments. The 10th cranial nerve is the vagus nerve. It provides parasympathetic control to most organs, controls voice muscles, and more. Why is it called the wanderer? Comment below. The 11th cranial nerve is the accessory nerve. It controls the sternocleidomastoid and trapezius muscles to coordinate head movements. How would accessory nerve damage present? Let us know. The 12th cranial nerve is the hypoglossal nerve. It controls tongue movements. What might you observe with hypoglossal nerve palsy? Comment your thoughts below. Here's a memory tip for remembering the cranial nerves. O, to touch and feel very good, velvet, our heaven. This stands for olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Can you create your own mnemonic for the cranial nerves? Share it with us. Thank you for watching this video on cranial nerves. We hope you found it informative. Don't forget to like, share, and subscribe to Med Madness for more exciting medical content. Which cranial nerve do you find most interesting and why? Comment below.